Good afternoon, everybody. Welcome to the NCSD and CDC SD Informatics webinar. This is our 5th or 6th informatics webinar in a series to sort of enhance and promote informatics, especially among STD programs. And we're really excited about today's topic, which is the ELC Health Information Systems Capacity and Data Modernization Initiative. We have some great speakers to talk about. And before we get started, let me go through some housekeeping and some logistics. So our facilitators for today are myself, Charlie Rabins. I'm a capacity building consultant with NCSD, along with my co-facilitator from CDC, Robin Hennessy. Robin, if you want to say a little bit about today's webinar and maybe our two CDC speakers.
Sure. Hi, folks. As everyone knows, I wear two hats, a CDC hat, but I'm also in a local health department. And I have often heard the phrase ELC, and I know that it's an important grant and it funds a lot of things, but it always felt like a mystery to me, and I didn't know who to ask. And so I came up with this idea of trying to have just sort of an ELC 101 for all the STD programs out there to just learn a little bit about this grant so we can speak about it intelligently when asked, but also focus in on some of the informatics projects that are happening via ELC. And so I'm really happy to introduce our speakers today. Aaron Borelli, he serves as the ELC Program Integration Advisor for CDC's Epidemiology and Laboratory Capacity Program in the National Center for Emerging Zoonotic Infectious Diseases. And if that weren't a mouthful enough, that's in the Division of Preparedness and Emerging Infections. In this role, Aaron provides strategic coordination among ELC's partner programs and manages various components of the National Cooperative Agreement. And Aaron has been with the ELC program for over 3 years. So thank you, Aaron, for making time for us. And then I'll just switch over and let you know about Michelle Hoover, who currently serves as the team lead in the Division of Health Information and Surveillance and leads the state implementation and technical assistance for the NCDS Modernization Initiative, as well as co-leads the Epidemiology and Laboratory Capacity Cooperative Agreement, which focuses on integrating health information systems, advancing electronic data exchange, including implementation of case notifications, electronic lab reporting, and electronic case reporting. But she's not busy at all. So again, thank you all for joining this call, and I'm really looking forward to what the presenters are going to share with us today.
Great, thanks, Robin. And I think we're really excited about today's topic, and we think it's really of interest. So kind of as we're getting people on board, I'll just do a quick poll question. So if you could tell us if this is your first STD informatics webinar, and I'll leave this open for maybe about 15 seconds. And I'm assuming we don't need an unknown or not applicable, since you either know if you are or you aren't, but hopefully. So give it another about 5 seconds and we'll close the poll out. Thank you, everybody who took the time to answer the poll question. Just to share the results. So almost 70% of you have been to another webinar, so that's great. Obviously, the content we've been providing was of enough interest, either the topic today or our past webinars, that we're getting a repeat audience. So thank you for returning. And for our newbies, welcome to our informatics webinar. We try to make these as informative as possible and hope you get a lot out of it. So, all right, so just a few housekeeping questions. We try to ask everybody to stay on mute unless you're presenting. So if you do have a question for the speakers, please put it in the chat box, and at the end of that presentation, we will go through all the questions, and then if we have time at the end, we might be able to open up online, but we try to make it as disruptive list as possible. So, thank you for that. Or you can use the question and answer function and use the chat if you have a problem. If for some reason I lose my internet connection, hopefully the Zoom webinar will continue and Robin will be able to continue as facilitator. But for some reason it crashes or I lose my voice connection or whatever, just stay on and we'll hold on and we'll improvise. We are going to make a copy of the slides and of this recording in about a week on the My NCSD Surveillance Community, which, stay tuned, I'm going to explain how to access that and give you some more information. So we've decided we're not going to provide a copy of the slides today, but they'll be available next week that you'll be able to review and download, as well as a recording of this session. So our agenda for today is I'm going to do a short update on some issues related to NCSD. Robin's really not going to do an update, so I forgot to take that off. But and then the main discussion topic today is ELC grant and how you can get involved in those kinds of things, and then we'll have a quick evaluation. So a little about NCSD. NCSD, we've been in existence for over 25 years. We really try to advocate for STD programs, provide technical assistance. And one of our issues is, we really try to do a lot of peer-to-peer work. And this picture sort of illustrates one of the areas we've sort of concentrated has been on STD surveillance, supporting the STD users groups, especially around PRISM, MAVEN, NBS, and then all the other people that have homegrown systems. And, I think it's always important to keep in perspective how far we've come with, STD surveillance and data collection. I will date myself. I started at a state and local health department in the 1970s, and then went to CDC for about 8 or 9 years, then went back to a state health department. And when I started, basically we were working off of card files. We did have a mainframe computer system where we had stacks of printouts with crosstabs that we would have to try to go to our data. But I think when you look back of how far we've come down to cloud computing with, you can do surveillance and analysis on your PC, your tablet, your phone. It's kind of amazing. But I think the other thing that I think COVID really pointed out too is that, infectious disease surveillance in this country, there's a lot of limitations. And I think all of us are trying to work at the state, local, national level to try to really enhance our surveillance systems to meet the needs of the 21st century. So this webinar is sort of an attempt to sort of help that along. I do want to make a shout out. I don't know if he's on our webinar today, but many of you know that Dr. Hillard Weinstock, who's been really running the STD surveillance branch probably for 10 or 15 years, is retiring at the end of the year. And I just, I wanted to really give Hillard a shout out because, both when I was as a director of the Illinois STD and HIV program for a while, and then my work with NCSD, Hillard has been a strong advocate for, STD surveillance, both at the national level, but really helping all of us at the state and local level to enhance our programs. And so, Hillard, thanks for all your work. We hope to see you in the future, but you've made some really significant contributions, and I just wanted to, thank you publicly. Robin, I don't know if you had any remarks or.
No, thank you. I think you said it all, Charlie.
All right, thanks. All right, so just a few things about NCSD. One of the things we really try to be very responsive and adaptive to changing conditions. So as soon as monkeypox really started hitting, the cases started increasing, and obviously it became, obvious that there was a sexual transmission to it, and there really wasn't a lot of information out there. We created a monkeypox command center on our NCSD website where we updated it almost daily with, news articles, information, links to CDC websites and stuff like that. So we still have this site up and running. I know monkeypox is sort of fading a little bit into the background, but things are still happening. And if you want some information, this is just one channel that you can go to on our website. So this is kind of what our command center page looks like. Many of you get our NCSD weekly email that we send out on Fridays, which has a lot of great STD news, like if there's a bill in Congress that people need to advocate for, or available training. So this is an example of our recent weekly email, and then we actually put blurbs about upcoming trainings, whether they're informatics webinars, user group meetings, or just general. We're having a DIS workshop. So if you're not getting the NCSD weekly, we really encourage you go onto our website, apply to be a member. It's free, and you'll automatically get our weekly email update. It's really a great resource. Something else that we've done probably 3 or 6 months ago was we created a sort of My NCSD peer-to-peer based community to share information where people can ask questions and post resources. And so once you're an NCSD member, again, it's free. You automatically get a link to this My NCSD website. And on the website, again, here's how to join. It's on our website. And once you click that, you'll get some information. But one of the things that we did do is, and we post news articles on the My NCSD website, there are several communities of specialty, like there's a DIS community where DIS can talk to each other. I mean, anybody can participate, but this is especially where DIS can go and they can ask questions about, how do you do field venipuncture? What's a good policy for workplace safety and field safety? Those kinds of things. So we have a DIS community, we have a Clinic Plus community for people working in STD clinics. And then one of the things we created over the summer was an STD surveillance and informatics community. We have about 300 people now that are members. So this is a great place where people can share resources, like we put the MMG guidance documents. Robin posts updates on there about CDC documents that are up there. People ask questions. So it's a great way to really promote peer-to-peer sharing. So I think most of you who are on this call today probably would like to participate on this. And this is also kind of replacing, we used to have Slack groups for all our STD user groups. And we've kind of, instead of having separate groups, we've rolled them all into this one big STD surveillance informatics community. So if you have any questions, you're going to have my email at the end of this webinar. You can email me if you have any questions about how to join. So again, I encourage everybody to join the My NCSD surveillance community to get some great information. An example of sort of how, and this is exactly where I'm going to be posting a copy of our informatics webinar. And on the website on this community, we have copies of all our old or past, I wouldn't say old, past recordings and slides from all our other webinars. So if you've missed one and the topic looks interesting, here's a place where you can have, it links you directly to our YouTube video of it. So just to give you an example of how you can post a question and some of the answers. And it's been a great resource of, again, promoting peer-to-peer technical assistance. So during the registration process, and kind of as an intro right before our speakers get started, is we asked everybody who registered for this webinar 3 questions. The first question was do you know who your health department's ELC coordinator is? Because usually it's either in the infectious disease program, or it might be run by the state epidemiologist, or different agencies have it in different places. And we're aware that not everybody knows. So it looks, I teased out everybody who said that unknown or not applicable. At least the people that either knew or didn't know, about half of you know who your ELC coordinator. And I think as you're going to learn from this webinar, it's really important to know who your ELC coordinator is, because you're going to want to talk to them and make sure that you have a seat at the table when there's discussions about how ELC funds are, what projects are they going to be funding, the issues around data modernization that they're supporting. So again, if you don't know your ELC coordinator, hopefully Erin and Michelle can sort of talk about, how do you find this out and how do you best work with those people? The second question we asked was, has your STD program been involved with your health department's discussions regarding data modernization. We know that we did have a couple of questions about what did this question mean, and is ELC supporting that? So I know Aaron and Michelle will talk about data modernization and its relationship to ELC, but at least of the people that said yes or no, and there were quite a few people that were not sure, it is encouraging that at least 80% felt like their STD program was aware of the data modernization questions. And then the third question we had, and it was a little bit, we've kind of learned afterwards, a little bit misleading question was, does your STD program, I have to move this thing a little bit, hold on. Does your STD program receive funding from the ELC block grant to enhance STD surveillance? It may be like your program doesn't, but you may be part of like an integrated infectious disease reporting system that does, but at least of the people that responded, about almost 60% said yes, that they felt that their STD program was probably, I'll say, benefiting from getting ELC grant funds. So, we thought these questions were a little bit, and maybe might help our speakers get a little bit lay of the land of who our audience at least felt. So without further ado, I'm going to turn it over to Aaron, who's going to start our presentation on Health Informatics System Capacity and Data Modernization Initiative. Aaron?
Yes, great. Thank you very much, Charlie. And thank you all for inviting me and for listening to our presentation today. It's great to be with you all. So yeah, I will kick things off and give an overview of our ELC program and then turn it over to Michelle to get into the more specifics about health information systems and data modernization. So all right, we can go to, here's our agenda. So the ELC overview, and then like I said, HIS and data modernization, and then we can talk a little bit about some strategies for engagement, and then questions. You can go to the next slide. All right, so what is actually not included, I believe, in this slide that is critically important, and I realized this after hearing some of the discussion that we had so far during this webinar, is that first of all, ELC is not a grant. ELC is a cooperative agreement, and we affectionately refer to it as ELC because we have a super long title, which is Epidemiology and Laboratory Capacity for Prevention and Control of Emerging Infectious Diseases. So we call it, and it is on here, Cooperative Agreement. Yep, there it is with the underline, which I believe links to our website. And so we refer to this as ELC to cover the cooperative agreement and really what over the years has evolved into a program at CDC in itself, because it is a very large, long-standing program. We have been around since 1995, and it has evolved over these 26, 27 years, how long it's been. We do have 64 awardees, or what we refer to usually as recipients, but they are the health departments across the United States. So we have recipients in the 50 states, the largest locals, so like Los Angeles County, New York City, Chicago, Philadelphia, Houston, and then also the U.S. territories and the Pacific Island. So that adds up to the 64. And we'll go into a little bit more about some of what's in here related to ELR, ECR, interoperability, et cetera. Michelle will cover more of those details. But there certainly is a health information systems component as one of our key pieces of this cooperative agreement. And I'll talk a little bit more about some of our different program areas in a second. So to give you all some context, in 2021, we awarded approximately $247 million to our 64 recipients. This does not include our COVID funding. Over the last few years, our cooperative agreement has awarded significant funding to our recipients to assist with detection and mitigation of COVID-19 and various different aspects. And so those have been supplemental funds that we have awarded through our cooperative agreement. But the $247 million is our core ELC activities, which are the program areas that we'll go through in an upcoming slide. And I think we can move on to the next one. Yep. So how we work within ELC really is through our governance teams that are in each of the health departments for our recipient jurisdictions. And these governance teams, the key person within the governance team really is the project director, or as Charlie referred to it, sort of an ELC coordinator, who kind of has the overall responsibility for managing the ELC portfolio within that jurisdiction. And also assisting that project director will be representatives from the three groups that you see here. So health information systems, epidemiology, and laboratory. So we often will have somebody who is a lead for each of those areas as part of that governance team. And then there may also be a couple other people. So there might be somebody who is sort of like a daily contact or more of an administrative manager. There's usually a fiscal person, and there may be somebody who perhaps represents the HAI group, but it's usually about 5 or 6 people who make up that governance team. And that group is who we at CDC ELC coordinate with on a regular basis related to managing the cooperative agreement, for providing information, for really all of the ongoing management and monitoring of this program is really with that governance team. And then we rely on the governance team to coordinate with all of the other either subject matter experts or component parts of our cooperative agreement to work on all of the other areas and coordinate those more specific programs or projects. This slide here shows, and I apologize, it's a little bit small. This comes from our guidance document, but it shows all of our components of the cooperative agreement. So this is sort of broken out into 3 sections. The first group is our sort of our cross-cutting areas with like cross-cutting epidemiology and laboratory capacity program, health information systems projects, and some other areas. And then the section 2 are the emerging infectious disease programs. So these are our large programs like food, water, enteric, healthcare associated infections, antibiotic resistance, and then vector-borne diseases. So we consider those programs because they are larger in scope. They are usually larger in funding. They sort of have risen to a program level. And then section 3 are the disease-specific projects. And so these ones may or may not be projects where we award funding to all 64 awardees or recipients, and also they are usually more specific on a more niche area, something more specific around infectious diseases. So you can see it is quite a variety that we have. So a really interesting group of projects. So this all makes up our ELC cooperative agreement. And just to highlight for you all for STD related projects, you can see the ones that are lettered S, T, and U are 3 that are very specific to the STD world. And we can go on to the next slide, please. So for the cooperative agreement, we kind of consider everything is falling within these 3 domains that I'm going to cover in these slides. So the first one is surveillance, detection, and response. I'm not going to read all of these to you, but you can see the types of areas and strategies that we consider as part of this domain, and especially important for infectious disease is investigation of outbreaks and surveillance, reporting, lab testing, lab coordination, and then you can see here also electronic information exchange and the importance of that. So that's our first domain. And then the next slide has prevention and intervention. So a variety of different areas that can fall within this for public health interventions and tools, health promotion, implementing public health best practices, and then surveillance data that is used to inform and prepare intervention strategies. And the third one is communications, coordination, and partnerships. So facilitating information dissemination to the public regarding infectious disease surveillance, enhancing collaborations between state epi and lab, as well as regional or local public health departments, and then strengthening partnerships between public health labs, et cetera. And also one of the key things to think about here, because it's sort of mentioned in that second bullet, is there is certainly a lot of coordination and partnership between the state health department and the local health department. And we rely on our state health departments that receive this funding to coordinate with locals in their jurisdiction as appropriate. So I mentioned that there are some large locals that are their own separate recipient of these awards, and they manage things within their own local jurisdiction. But for all of the others, for the states, we rely on the state to determine the best way to partner and collaborate with the locals. And so that is something that is important to us. But that's sort of the main structure for the cooperative agreement and what our 3 domain areas are. And then the next slide, this starts to get into Michelle's group with health information systems. I do just want to mention, though, that if it's not obvious from that introduction of ELC, we do work across the entire agency of CDC. So we partner with various centers across CDC. We are not just confined within our center where ELC is managed. We have lots of different program areas, and that does span different program areas across CDC. And so we sort of serve as our center's way of supporting our extramural program implementation through this cooperative agreement. And also, just as some background, we are on a 5-year cycle. And like I mentioned, we have been in place since 1995. So we have had continuous 5-year cycles of our cooperative agreement since then. And so we are currently in, within one of those 5-year cycles in the 4th year of a 5-year cycle. And so coming up pretty soon, we'll be announcing the next 5-year cycle. And so it just continues, throughout that time period. But just to give you a little bit of background on the logistics of how our cooperative agreement works. So I think I covered everything I wanted to within within the introduction and overview. Happy to take questions later, but now I'm going to pass it over to Michelle Hoover, who will begin to talk about health information systems.
Thanks, Aaron. Kind of building off of what Aaron had mentioned in terms of collaborations, the ELC as a whole, as you saw, has many different pieces and parts to it. HIS is definitely one of the largest, and we really do see ourselves as cross-cutting, and I apologize, I have a furry coworker who will answer any question that I can't answer later on, but she's kind of blocking my camera at the moment, so hold on there. Apologize for that. But we at the HIS side of the house, and I'm also speaking on behalf of my other 2 colleagues that kind of co-lead these efforts. Teresa Jew and Megan Light lead the efforts for the health information systems capacity and the data modernization efforts within NCDS, where Aaron and the overall ELC program sets, and I sit within the Center for Surveillance, Epidemiology, and Laboratory Services, and I'm also a lead with that. So the 3 of us work collaboratively together to work with all of the centers across the agency to help them with their health informatics and surveillance efforts and activities. So we are not programmatic specific at all, which makes us a good place to go to kind of find how to work with or how to achieve different efforts and activities. And we can partner you up with other programs that can collaborate with each other and kind of build upon the efforts that are going on with surveillance and informatics and data modernization. Sorry. I have a cat head there. So we really are cross-cutting. We have some major activities that we are working on. A number of them are directly related to the efforts that you all do on a daily basis in STD. We really need to maintain and enhance our electronic laboratory reporting. We know ELR is definitely, shall I say, the bread and butter of a lot of diseases, and in particular for STD, in terms of creating cases and being able to identify cases. We also support programs' ability to kind of really monitor and control and prevent their threats by really standardizing the reporting of surveillance data. So we are really focused right now on trying to figure out ways within individual health departments and local as well as state health departments, so that they can share data with each other. And the easiest way to do that is to have it more standardized so that electronic data exchange can take place, so that people are really aware of what's going on in their local areas. And then last, but certainly not least, is really to advance electronic data exchange between jurisdictions. So we know people travel back and forth between different places at various points in times. And one of our goals is really to be able to share that information and data freely with other jurisdictions who have, so that we can share that back to the state that it belongs to, as well as back and forth, so others can know that. And of course, now as we're moving more into data modernization, is also linking the data that we currently have with other data sources that may be separate and apart from what we've used in the past, so that we can make better decisions and develop better efforts to address our disease topics. The second major thing that we work at is really to help sustain and enhance our information systems. So we provide funding to jurisdictions to help them with their systems. There are certainly some jurisdictions that have one large system that includes the STD activities in it. We call that sort of their integrated systems. And we also have a number of jurisdictions that have their own separate systems for STD, TB, and hepatitis in particular. And so we work with all of those. And as I said, we're really trying to figure out, how do we help enhance that information that they're already collecting? And also, as we move forward, especially with data modernization that I'll get to here shortly, how do we really work at providing really enterprise-wide solutions? So how do we get health departments to really look across their entire ecosystem of systems, so that they can work together to provide services that one individual system may not be able to do? Moving along there. One thing that we did want to point out, STD has been a critical partner for our program for as long as I've been around, and long before I arrived on the scene. And so much so that it really is one of our performance measures that we use for our health information system. So we wanted to just make folks aware that we really do have a keen interest in helping assume and reduce the burden of the reporting for STD diseases. And one of the ways that we are tracking that is looking at those percentage of STD case investigations, be it one of chlamydia, gonorrhea, et cetera, to be auto-created from an ELR. So that way it reduces the burden on individual investigations and follow-ups, but allows you that also the ability to add that information later on if you need to, as needed or becomes necessary. What I'm going to move to now is really looking at another piece, which is our data modernization initiative. And I want to start out by saying you will hear the term data modernization thrown around a lot. DMI, we jokingly say it's anything and everything all at the same time and nothing at the same time, as much as it's being used right now. So in 2020, We at CDC received a very small amount of funds at the time to really begin to look at data modernization across health departments. And we're really focused on some of these efforts and activities that I'm going to mention here in a moment that are critical and really critical for having all of you who are working in this field and across the health departments participating in those efforts and activities so that we really can build those best infrastructures that will help us long-term collect any of the data that we may need as we go forward. The next year, we ended up getting a huge amount of money that is related to data modernization. And so therefore, there are lots of other projects that are out there. There are grants that was just awarded that focus on modernizing the workforce and the infrastructure for state health departments. So the piece that I'm going to talk about here today is the one that is particularly related to our ELC efforts and was placed in ELC to begin with. But I wanted to make you aware of those other efforts and make sure that you're keeping your eyes open and your ears on the ground to see how you can become involved and engaged in all of those other efforts and activities as well, to try and enhance your systems or take advantage of the enhancements that may be taking place at the larger level within the enterprise-wide health department. So the idea of data modernization really was to modernize and create more interoperability, as well as building the workforce and the other skills that are needed to share high quality data that can be used for analytics and used to address the specific needs that jurisdictions have related to different efforts and activities. So as you can see, it really was based off of and came out of the idea and happened to be the only ELC application that was submitted in 2020 as we were going into the COVID pandemic. But it really is trying to enhance those efforts that ELC is already working on, as well as looking at all of the areas that we just sort of mentioned related to improving systems. Some of those strategies, though, that we're really looking at are efforts that are still underway, and we want to make sure that our partners in STD are at the table and are participating in these efforts and activities. So the first strategy really was to help understand what is currently happening within the health department itself and providing a person who would actually help lead those efforts. So every jurisdiction that received funding has a DMI lead on a DMI director. And I was happy to see that many of you are well aware of your leads. If you are not, or if you want to know who it is, I have Josue Toledo, as well as some of my other partners that we work with in the ELC program, and we can easily provide you with that information of who that lead contact is. So if you need that information, you can easily email us at edx@cdc.gov. That stands for Electronic Data Exchange. And that's just our main mailbox that we use to triage information. And I believe we list that on the last page as well. But the idea was to lead it and then really understand what is it that we need to do. So really assessing and seeing where we are was that first level. And that has taken some time and is an area that a lot of people are still continuing to work on. And then the next part of that is really implementing those pieces within their data and health information systems and helping to train up their workforce and accelerate those efforts and activities that will help move the field forward as a whole and reduce the burden and be able to, as we jokingly say, process, provision, analyze, and use the data to make public health decisions over time, be it in an emergency or be it in your standard practice, but being able to use the information that you have to make those decisions. So this one sort of goes in here. We go into a little bit more, but the piece I really want to talk about with this is that we really want to do an entire gap analysis, needs assessment of both the workforce and the infrastructure to really help complete a plan. So we want a kind of high-level plan that we know that will continue to grow over time. And this is one of those areas that we think is critical for our STD partners and other programmatic partners to make sure that they are coordinating or having an into this area and are part of that effort of doing that gap analysis and doing that assessment. It will help identify for the jurisdiction, what are the needs that you have within your system now? What are some of the things that could be enhanced in your system, either in a short term or long term, or what are ways in which you can kind of consolidate resources to be able to use things like what we call enterprise services, such as master person indexes or data lakes or data warehouses that can really help you integrate data from a number of different areas that will ultimately help each of our programmatic areas achieve the goals that they're looking for. And if we go to the next slide, this really is the detailed outline of what it is that we are asking each of the health departments who receive the funding to do. Really assess and report back what they found within their jurisdictions and health departments, and then really sitting down and thinking through what are those things that we can do to make things better across the board. Where can we share efforts and activities to reduce the amount of funding that needs to go into each one of them so that that funding could be used for other purposes that may still be needed or may be lacking? And how do we build up, again, those shared services, or what we're sort of now calling it CDC Building Blocks, things that will really help an entire entity or enterprise be able to identify and provide the services they need for a person by being able to link across systems, because we all know that I'll put my hand up here, we've all done it. We've all at CDC provided lots of money to lots of people to do lots of different things that created lots of different silos. So what we're trying to do now is figure out how do we sort of break down those silos, or not necessarily taking them completely away because they were established for a reason, but making sure that they're coordinating and collaborating with others so that they can learn from each other and that they can use each other's resources to be able to address any of the issues or challenges that they have within their surveillance and informatics world. We go to the next slide. I think these kind of go through a lot of the same things, so I'm not sure that there's anything here. Like I said, it's just the second thing is really looking at that plan. What we're really trying to emphasize with a number of these things is that collaboration piece that Erin mentioned earlier, of making sure that you're collaborating with each other and are able to work with each other to kind of forge those partnerships, both internal to the health department, as well as with partners and other stakeholders that you have in your communities that can really help all of us as we move forward. Let's move to the next slide. Like I said, a lot of this is a lot of the same thing, and I think we'll cover it. And like I said, we will provide you with all of these slides, but we just wanted to give you a broad idea of what the modernization and the DMI efforts are looking like, and we're looking like to begin with. And a lot of people are still working on these efforts. They're completing their assessments, but we want to make sure that, like I said, the assessment really includes all parts of the health department. Next slide. So one of the things, as I said, we're really here right now to kind of give you a better feel for what it is that we do on the health surveillance and informatics side of the house, give you a large idea of what it is that ELC does as a whole. But our whole goal really is to kind of help forge these strategic partnerships and engagements across the individual health departments, and also at times between individual health departments. As you know, states come right up against each other, and many people travel back and forth. So how do we work together to try and help exchange that data in a way that is useful and reduces the burden on others? So some of this is referencing our jurisdictional contacts that are in our REDCap, which is the system we use for our program monitoring for ELC. And what we can do with that is, depending on what questions you are, and we will definitely stay in touch with Charlie and Robin and others to see, are there things that we may have or have information that may have been provided to us that we can share with others, as well as hoping that the jurisdictions and states share with each other about what it is, so that we can really look at those larger strategies and initiatives to really have, as that second bullet says, a modern infrastructure that allows us to really look at all of the data that may be coming in, be it through ECR, ELR, syndromic surveillance, vaccine records or vital records, and being able to use that in a way that helps serve the entire public as a whole, so that you're working, I hate to use the term where they say smarter, not harder, but we're really hoping that some of the technology will help automate pieces of this that will make it much easier and reduce that manual burden, so that resource and the resources that are going into it now in terms of people hours can be put to other efforts that are people are spread so thin these days, so that we can really kind of help address those other areas that often don't get looked at because we're so busy trying to get those basics done. So if we can automate those, use other tools and get that information into us easier and be able to share it more quickly with others, it will certainly help us all by leveraging that knowledge and sharing lessons learned of what we've each done within our systems or health departments, within, be it with STD, with HIV, with TB, with others, to learn from each other and be able to apply that at a larger scale to kind of become more of what I think our overall vision for DMI is, that there will be more of what we call shared services. So people are using that, and so they will still have their own individual databases, they may have their own other pieces, but there will be a lot more ability to analyze, process, and get to use and visualize the data more quickly over time by building out these other efforts. And there you go, there's the EDX things. This is just really some of the things that we use. We know that all of you have monitoring calls as well. And I think, yeah, hopefully we didn't take too much time, Charlie, but we certainly can answer a number of different questions you have about anything related to ELC as a whole that you've always wanted to have and ask. I thought that was a great question, and Erin and I will try to answer it. And if not, my cat that you have seen way too much of today will get back to you at some point in time with the answers, I'm sure.
Oh, great. Really appreciate presentations, Erin and Michelle. So now's a chance for all of you to have, if you have questions, you can either put them on chat or take yourself off of mute and ask a question. We ask, if you're not asking a question, keep yourself on mute, but as you can see, this is really important initiative, and I think this would be a great way to, be able to tap into some funding and work collaboratively with your other programs to sort of enhance your surveillance. So What kind of questions do you all have for our speakers?
Hi, Charlie. I'm going to take the first question.
Okay.
So Michelle, you mentioned DMI, Data Modernization Initiative, means nothing and everything and something. So I remember that it was the National Modernization Initiative that was going on. And is there a relationship? Is NMI something we don't hear anymore?
That's a great question, Robin. We are sort of, as part of our efforts for data modernization, and in particular, like you said, our NCDS modernization related to message mapping guides. As part of this larger modernization efforts, we are sort of looking at what are the best ways to share data back and forth that may reduce the burden on the states. We recognize that doing the message mapping guides themselves require a lot of work. We're still definitely working with others and working with programs to implement those message mapping guides. Our focus has really been now on trying to get those few states that haven't implemented what we call those core Gen V2 data elements to get to the level where they can provide that data. But we're also exploring other efforts at the same time to see what would work for all programs to really get the data they need during an emergency response or other efforts, so that we're not having to have multiple, the jurisdiction may have multiple ways in which they send it, but that CDC isn't forcing everyone into one particular way that they would send that data during a time. And the example I can use that will probably resonate with most of you in this thing is the data related to monkeypox. So or mpox. So for us in the NCDS land, we really worked hard to try and put information out there so that basic information could come in, but we also knew that there was additional information related to vaccines, all sorts of other risk factors that are not there. So we're currently kind of undergoing that process of working to see what long-term, what is it that we want to bring in, and how do we reduce that burden on the states, because we know it requires a lot of mapping, a lot of information that may happen. We're looking at ways we may be able to standardize questions so that it's easier to ask the questions over time versus kind of relying on machine learning, so to speak, instead of always doing just, what we're very traditionally acute with, which is the case report forms, which will look slightly different as we've seen over the last couple of responses, change multiple times. So we are still working with our partners in our STD program to onboard folks that are willing and have put in the effort up to this point in time to work on their STD and congenital syphilis message mapping guides. But we really are trying to figure out what are ways that we can help improve that process as we improve our technology and processes.
Great. Other questions from our participants? Again, either in chat or take yourself off of mute. Is there a website where the ELC project directors are listed and their contact information?
I don't think so. I don't think that we share that information broadly. If somebody wanted to find out who their project director is, I would suggest that they ask within their health department. If they ask around and find out who is serving in that role, I'm sure they probably have a general idea who is working with ELCs. Like you mentioned earlier, it's probably somebody in their infectious diseases area, and probably just ask around for who's serving in that role, but we don't share that information.
Okay.
Yeah.
Okay, last call. Any other questions? Again, put them in the chat or take yourself off of mute. And I think if you do think of a question after this, you can send it to Robin or I, and we'll forward it on to our speakers. So oftentimes great things happen after our webinars as well. While we're waiting for other questions, let me see if we have anything else. I don't, do you want to talk about these resources, or should I just skip through them?
I can just mention them really quickly. These are really the key players, and Aaron is familiar with these. These are the key people that we know that we work on a regular basis, and acronyms that are used on a regular basis. So people, when they're speaking, I spent my first year telling people I don't speak IT, I speak English. And so now that I do speak IT, I'm still well aware that you need to have a lot of lists and acronyms and other information. And as you can see, a number of them are linked so that people can find out a little bit more information about each of those other areas. And as Aaron says, we have the ELC Cooperative Agreement up there for people who may be interested, or people within their health department with those other projects that have a clear focus as well within the STD framework, such as SETNet. Oh, we don't have to worry about performance measures. Sorry, that we kept in there.
Okay, so we're almost out of time. We always try to do, evaluation is such an important component of surveillance, as all you know. So I'm going to launch one more poll. And it's a simple poll, but basically we're trying to determine, was today's webinar useful? Yes or no. And, if you have a couple things, again, if you have suggestions on how we can always improve our webinars or specific topics, please reach out to Robin or myself. We do listen, and a lot of the great ideas for webinars come from you all. And, we're here to really, again, promote peer-to-peer learning and assistance. So, please give us information. And if there's others, again, specific questions related to the ELC Cooperative Agreement, please, again, feel free to either use that EPIX email, or get it to Robin or ourselves, and we'll get it forwarded to you all. So another 10 or 15 seconds, and we'll close out the poll question. And I would also encourage you to use the My NCSD Surveillance website if you have questions, or you want to talk to somebody, find out who else is doing some STD specific work. Ask a question about that, and hopefully your peers will answer. We'll try to identify somebody who's worked on a specific project, whether it's related to congenital syphilis, or streamlining electronic case reporting or lab reporting, or all sorts of different things. So there's a lot of expertise out in the field. It's just sort of tapping into it. So 5 more seconds and I'll close out the poll question. So glad to see that almost everybody thought that the meeting was either very useful or somewhat useful. So we appreciate that. And again, we're always looking to enhance, and we believe in continuous quality improvement. So if you have any ideas of how we can improve our webinars and topics, please let us know. So again, just a couple things. We will post a copy of the recording and a copy of the slides on My NCSD in about a week. And so, just be looking out for that. Most of you who are on My NCSD get a sort of a push out email saying, hey, there's something that's been added. So you'll know when it's up there. But if you have any questions and you don't seem to find out, just again, contact Robin or myself. Again, lastly, I really want to appreciate, all the work our speakers went into preparing the webinar and conducting the webinar, as well as all of you for, number one, all the work that you do under very trying situations, with COVID, MPOX, and just STD surveillance in general. You all are heroes out there that I think the general public doesn't recognize enough of all the great work that's being done. So thank you. And if that's it, I think we'll end today's webinar. So Thanks for participating.
Thanks, everyone, and have a great holiday. Take some well-earned rest.